Hello everybody, thank you for watching this video. I hope you're safe, that you take care of yourself and you take care of others. I think it's a good moment to talk about medical services, about healthcare, for various reasons. The first reason is about the need. Of course, there is a tremendous need all over Europe, all over the world, about efficient and effective medical services. And we can see huge discrepancies between territories and regions. We are not equal in terms of medical services. It's a question of Commission, European Commission. They just extended the eligibility of health and health services, and there is now an extended possibility of funding by reallocation of funds. 37 billion euro are now available for this, so this is an opportunity. And finally, it's a question of simplification, how to make it very simple, very visible, very measurable. And for this, I propose you to go back to a log frame approach. So if we go to a log frame, we can see that there are different ways to tackle the subject in terms of beneficiary, in terms of input, in terms of output and result. Let's say that the beneficiary could be any medical entities, private, public, we don't care, at a certain point, because we got to deliver the service more than everything. EU funds, so of course with co-financing, but EU funds can be mobilized for this. And what could be the output? The output could be beds. Of course, we can finance some masks, we can finance some ventilators, we can finance some staff or some general cost. But the idea is to make it visible by everybody. And the question could be to finance some beds. Some beds to make prevention, to make normal care. But I think these days it's a question of intensive care, and there could be a focus on this. What's the result? It's a result on the people, on the patients benefiting of intensive care. And at the end of the day, it's a question of patients saves. So you can see all this is a question of being visible, being measurable, to be more efficient, more effective using EU funds. So let's think now what could be the calculation methods, because we got to make it as simple as possible. The proposal could be to have, because of this log frame, a cost per unit approach. You all know the simplified cost. You've heard about this. And I think we got in this crisis a good occasion to shift from a normal eligibility possibility to a full funding based on units, based on outputs. So what could be the idea? The idea could be for each bed, we can have an average cost. We can have an extrapolated cost. It's a question of the cost of the place. We need to use a place. It's a question of square meters. It could be a question of construction, because we got some time to construct very quickly. It could be a question of renovation. It could be a question of rental. It could be a question to set up a place, and the average cost to use for 1 month, for 6 months, for 1 year, we can have an average cost. It's a question of equipment. We need some ventilators, we need some beds, we need some masks, whatsoever medical equipment we need. That could be inside the calculation of this cost. It's a question of staff. We need nurses, we need doctors, and to have intensive care, it's a question to have a bed with intensive care. We need, of course, some staff overheads. There are always overheads. It could be 15% of the staff cost. It could be more, but it's a question also of calculation. All because of this, we are thinking about social effectiveness. We want to have these beds functional in order to address the results. So as you can see, all this is a question of calculation in a certain way, to find the best calculation in order to have a good framework. So at the end of the day, we can have a framework, EU funding fast track approach, and how to make it. The idea could be, of course, to think about the standardized unit cost, all in options, all the costs are including into the cost. We can pay by unit, the idea that each time we got a functional unit, we can pay, we can grant this beneficiary. Emergency purchase, I mean, in terms of public procurement, we can allow some emergency purchase, that's the idea. The idea is to buy as quick as possible. Full stated compatibility, so the idea could be to have an obligation of public service. I was talking about inequalities all over Europe, and this question of inequalities could be the question to set a ratio of beds per inhabitants, per 100,000 inhabitants, and because of this, to set an obligation of public service in order to make it fully compatible with state aid, and also in order to have this social effectiveness. So all this in order, once again, to be visible, to be effective, and I think it's a good moment to think about it. Thank you for watching, and once again, take care.